What medical pathologies have been proven and scientifically proven to benefit from the use of cannabis? There are some medical pathologies in which the use of cannabis has been studied and shown scientifically proven benefits. However, it is important to highlight that studies on the efficacy and safety of cannabis are still ongoing, and more research is needed to obtain more definitive conclusions. Some of the pathologies in which cannabis has shown potential benefits include: 1. Epilepsy. Cannabis has been studied in the treatment of certain types of epilepsy, such as Dravet syndrome and Lennox-Gastaut syndrome, showing a significant reduction in seizures in some patients. 2. Chronic pain. Cannabis has analgesic properties and can help alleviate chronic pain, including pain related to conditions such as fibromyalgia, arthritis, and neuropathy. 3. Chemotherapy-related nausea and vomiting. Cannabis use can help reduce nausea and vomiting caused by chemotherapy in cancer patients. 4. Multiple sclerosis. Cannabis can have positive effects in relieving symptoms associated with multiple sclerosis, such as muscle spasms and pain. 5. Glaucoma. Some studies suggest that cannabis can help reduce intraocular pressure in glaucoma patients, but the effects are temporary. Theme 1. Medical cannabis is a topic that has aroused increasing interest in the scientific community and society in general. The cannabis plant contains more than 100 chemical compounds known as cannabinoids, the most studied and known of which are delta-9-tetrahydrocannabinol, THC, and cannabidiol, CBD. Research into the use of medicinal cannabis has focused mainly on the therapeutic benefits of CBD, which is known for its anti-inflammatory, analgesic, anxiolytic, and antipsychotic properties, among others. CBD has been studied in a variety of medical conditions, including epilepsy, chronic pain, sleep disorders, anxiety, and depression. Regarding epilepsy, several clinical studies have shown that CBD can significantly reduce the frequency and severity of seizures in patients with certain types of refractory epilepsy. This led to the approval of a CBD-based medicine called Epidiolex in the United States for the treatment of some rare forms of epilepsy. In the field of chronic pain, medicinal cannabis has been considered an option for patients who do not respond well to other conventional therapies. Studies have shown that CBD can help alleviate pain related to conditions such as fibromyalgia, arthritis, and neuropathy. Additionally, medical cannabis has been explored as an option for treating symptoms in patients with multiple sclerosis, such as muscle spasticity, pain, and sleep disorders. Although scientific evidence is still limited, some studies suggest that cannabis may provide relief from these symptoms. However, it is important to highlight that research into medicinal cannabis is still ongoing and there are many open questions. The dosage, form of administration, and long-term effects of cannabis use still need to be studied further. Furthermore, the side effects and risks associated with cannabis use must also be considered, especially in younger populations and in patients with pre-existing medical conditions. It is essential that the use of medicinal cannabis is supervised by qualified healthcare professionals who can individually assess the risks and benefits for each patient and advise on the best treatment options. The legalization and regulation of medical cannabis use are also important topics being debated in many countries around the world. Theme 2. Let's talk about another important aspect related to the use of medicinal cannabis, the treatment of neuropsychiatric disorders. In recent years, there has been growing interest in exploring the therapeutic potential of cannabis in treating neuropsychiatric disorders such as anxiety, depression, post-traumatic stress disorder, PTSD, and schizophrenia. Regarding anxiety, some studies suggest that CBD may have anxiolytic effects, helping to reduce anxiety symptoms in patients. However, it is important to highlight that the effects of cannabis can vary from person to person, and some evidence also indicates that high doses of THC can increase anxiety in some people. As for depression, although research is still limited, some preliminary studies suggest that CBD may have antidepressant properties, helping to alleviate symptoms in some patients. However, more studies are needed to better understand this relationship. In the case of PTSD, some studies have explored the use of medicinal cannabis as a treatment option for symptoms related to the disorder. Some patients report relief from symptoms of anxiety and insomnia after using cannabis-based products. However, it is important to highlight that the use of cannabis for treating PTSD is not yet widely accepted and more research is needed to assess its effectiveness and safety. As for schizophrenia, the relationship between cannabis use and the development or worsening of symptoms is still a controversial topic. Some studies suggest that cannabis use, especially in high doses of THC, may increase the risk of developing psychosis in predisposed people or worsen symptoms in patients with schizophrenia. However, more research is needed to better understand this complex relationship. It is important to highlight that the use of medicinal cannabis in the treatment of neuropsychiatric disorders must be carefully evaluated by qualified healthcare professionals. The dosage, form of administration, and product selection must be individualized for each patient, taking into account the potential risks and benefits. Furthermore, it is essential that cannabis use is integrated into a comprehensive treatment plan, which may include behavioral therapy, psychosocial support, and, in some cases, conventional medications. Theme 3. We will discuss the use of medicinal cannabis in the treatment of conditions related to neurology. Cannabis has been studied as a therapeutic option for several neurological conditions, such as Parkinson's disease, amyotrophic lateral sclerosis, ALS, Alzheimer's disease, and migraines, among others. In the case of Parkinson's disease, some studies suggest that the use of cannabis can help alleviate motor symptoms, such as tremors and muscle stiffness. Additionally, cannabis may have neuroprotective properties, which may be beneficial for disease progression. However, more research is needed to confirm these effects and determine the ideal dosage and form of administration. ALS is another neurological condition in which medicinal cannabis has been studied. Some studies indicate that the use of cannabis can help reduce muscle spasticity and improve quality of life in ALS patients. However, the results are preliminary and more research is needed to assess long-term efficacy and safety. In the field of Alzheimer's disease, preclinical studies suggest that CBD may have neuroprotective and anti-inflammatory properties, which may be beneficial in preventing or treating the disease. However, it is important to highlight that research in humans is still limited and more studies are needed to better understand this relationship. Migraine is another neurological condition in which medicinal cannabis has been explored. Some studies suggest that cannabis may help reduce the frequency and intensity of migraine attacks, possibly due to its analgesic and anti-inflammatory properties. However, more research is needed to establish long-term efficacy and safety. It is important to highlight that although medicinal cannabis may offer potential benefits for these neurological conditions, adequate medical monitoring is necessary. Each patient is unique and may respond differently to cannabis treatment. The dosage, form of administration, and selection of products must be made under medical guidance, taking into account individual risks and benefits. Furthermore, it is essential that cannabis is used as part of a comprehensive treatment plan, which may include other therapies such as conventional medications, physical and occupational therapy, psychosocial support, and lifestyle modifications. Research into medical cannabis in the field of neurology is constantly evolving, and more studies are needed to determine its exact role in treating these conditions. Theme 4. The use of medicinal cannabis in the treatment of conditions related to mental health. In recent years, there has been growing interest in the therapeutic potential of cannabis for treating mental illnesses such as anxiety, depression, post-traumatic stress disorder, PTSD, and sleep disorders. When it comes to anxiety, there is preliminary evidence to suggest that CBD, one of the main components of cannabis, may have anxiolytic properties. Studies indicate that CBD can help reduce anxiety in conditions such as social anxiety disorder, post-traumatic stress disorder, and generalized anxiety disorder. However, it is important to note that individual response may vary and that more research is needed to better understand the effects of cannabis in treating anxiety. Depression is another mental condition that has been the target of studies on the use of medicinal cannabis. Some studies suggest that CBD may have antidepressant effects, helping to alleviate symptoms of depression in some patients. However, it is important to highlight that the research is still in its early stages and more evidence is needed to confirm these effects. In the case of PTSD, medicinal cannabis has been considered as a treatment option for symptoms related to the disorder. Some patients report improvement in symptoms of anxiety and nightmares after using cannabis-based products. However, it is important to highlight that individual response may vary and that more research is needed to assess long-term efficacy and safety. Additionally, medical cannabis has also been studied in the treatment of sleep disorders such as insomnia and sleep disorder related to post-traumatic stress. Some studies indicate that cannabis can help improve sleep quality and reduce difficulty falling asleep. However, it is important to consider potential side effects, such as daytime drowsiness and dependence, and the need for appropriate dosages and medical monitoring. It is essential to highlight that the use of medicinal cannabis in the treatment of mental illnesses must be carried out under adequate medical supervision. Each patient is unique and may respond differently to cannabis treatment. The dosage, form of administration, and product selection must be individualized for each patient, taking into account the potential risks and benefits. Furthermore, it is important to emphasize that cannabis should not be considered as an isolated solution to mental health problems. Effective treatment often involves a multimodal approach, which may include psychosocial therapy, lifestyle changes, emotional support, and, in some cases, conventional medication. In summary, although there is preliminary evidence suggesting that medical cannabis may have benefits in treating conditions related to mental health, more research is needed to fully understand its effects, ideal dosage, and possible side effects. Consultation with a qualified healthcare professional is essential for a safe and effective approach. Theme 5. How the medical use of cannabis is legally assessed. The legal assessment of the medical use of cannabis varies from country to country and even within different states or regions within a country. The legality of the medical use of cannabis is determined by the legislation of each locality and is subject to change over time. In some countries, the medical use of cannabis is fully legalized and regulated. In these cases, cannabis is recognized as a legitimate therapeutic option and patients who meet the established criteria have legal access to medicinal cannabis-based products. These countries generally have regulatory systems in place to control the production, distribution, and use of medical cannabis, guaranteeing the quality and safety of the products. In other countries, medical cannabis may only be permitted in specific and restricted cases. In these cases, there are usually strict criteria that patients must meet in order to gain access to medical cannabis. This can include specific medical conditions, obtaining a medical authorization, or participating in research programs. In addition, in some countries, medical cannabis may only be legal for certain components or extracts of the plant, such as CBD, while recreational use or other components of cannabis may be illegal. On the other hand, there are countries where the medical use of cannabis is still prohibited and considered illegal. In these cases, the use of medical cannabis can be criminalized and patients can face legal penalties for its use. It is important to note that the legal situation of medical cannabis is constantly evolving and can vary widely in different parts of the world. It is essential that patients and healthcare professionals are aware of the specific laws and regulations in their country or region before considering the use of medical cannabis. Furthermore, even in countries where the medical use of cannabis is legal, there are specific restrictions and regulations that must be followed. This may include obtaining a doctor's prescription, purchasing products from authorized sources, and adhering to possession and dosage limits set by regulatory authorities. In summary, the legal assessment of the medical use of cannabis varies according to the legislation of each country or region. It is important that patients and healthcare professionals are aware of the laws and regulations applicable in their place of residence before considering the use of medical cannabis. Describe cannabis from various points of view. From its scientific classification to its variation in species to its variation in medicinal effects and its harmful effects characteristics. Cannabis, also known as marijuana, is a plant that has been used for both medicinal and recreational purposes for thousands of years. The plant is complex, with a number of species and varieties, each with its own characteristics and potential effects. Translated with www.dpel.com/translator, free version. Scientific classification. Cannabis belongs to the Cannabaceae family and the Cannabis genus. There are 3 recognized species: Cannabis sativa, Cannabis indica, and Cannabis ruderalis. However, there is an ongoing debate among scientists about this classification, as many argue that the differences between sativa and indica are mainly agronomic and not genetic. Species variation. Cannabis sativa. This species is generally tall and slim, with thin leaves. It is known for its stimulating effects and is often associated with an increase in energy and creativity. Cannabis indica. This species is generally shorter and thicker, with broad leaves. It is known for its relaxing effects and is often used to relieve pain and help with sleep. Cannabis ruderalis. This is a smaller and less common species. It is not typically used for recreational purposes due to its low THC content, the main psychoactive compound in cannabis, but it is valuable to breeders due to its ability to flower automatically based on age, rather than changes in light. Variation in medicinal effects. Cannabis has a variety of potential medicinal applications. THC can help relieve pain, nausea, and insomnia, while CBD, another compound found in cannabis, has anti-inflammatory properties and can help treat anxiety and epilepsy. In addition, different strains of cannabis can have different ratios of THC to CBD, which can influence their medicinal effects. Characteristics of harmful effects. Despite its potential medicinal benefits, cannabis also has a number of possible harmful effects. Long-term use can lead to addiction and withdrawal syndrome. In addition, cannabis use may be associated with an increased risk of mental illnesses such as schizophrenia, especially in people with a genetic predisposition to these conditions. Cannabis use can also have negative effects on memory and attention. In addition, cannabis smoke, like tobacco smoke, can be harmful to the lungs.